Global COVID-19 infections have hit 115.76 million confirmed cases, with the death toll reaching 2.57 million. In South Africa, there have been 1,447 new cases, taking the total reported to 1,516,262. Deaths have reached more than 50,000 at 50,366, a daily increase of 95, while recoveries have climbed to 1,434,772, leaving the country with a balance of 31,124 active cases. So the total number of vaccines administered is 83,570. All of these figures are important as South Africa observes 1 year since the announcement of Patient Zero. That was tomorrow, the anniversary. And the Health Minister, Dr. Zweli Mkhize, will address the press club shortly on this milestone. But for now, let's speak to Professor Mosa Moshabela, who joins us as the Dean and Head of Laboratory Medicine and Medical Science at University of KwaZulu-Natal. A very good evening to you, Prof, and thank you so much for speaking to us. So I'm just wondering, for you, 1 year on, what is the most significant thing that we know now about COVID-19 that we didn't know then?
Well, Tsepiso, it's been an interesting year. I think that we now know that a disease like COVID-19 can unite people behind one cause. It's something that we did not quite see with other conditions like HIV. There was a lot of movement, but it was mostly around people who are affected. But with COVID-19, we've seen a lot of people come together, and in a way, it taught us that we are more connected than we would like to acknowledge and admit in many ways. And for us, I think that in the healthcare services, we realize that we have to shift from caring for diseases towards caring for people, because the kind of thinking and approach you use is very different when you care for people. It's a lot more complex and much more difficult.
So as a science community, when this pandemic, this disease, then it wasn't, was first revealed in China, what were the scientists here aware of? Did they know anything about it?
Yeah, I think that most scientists were, especially a lot of epidemiologists, but we were observing what's going on around the world. But in general, because we are also South African, and many of us were also kind of burying our heads in the sand and hoping that it doesn't really hit us. Somehow it will stop somewhere. But for me personally, the first week of February, I did a visit to Singapore, and at the time they had 12 cases. We didn't have any cases here. And that's when I realized that it's a lot more serious than we acknowledged. And when I came back, that's when we set up the war room at the University of KwaZulu-Natal in order to try and prepare ourselves. And people at the time thought that we were getting ahead of ourselves.
And it's very interesting that you say that, because I'd like to hear from you a country context, what then became obvious as different. You say you were in Singapore, and when you came back, you realized that we're contending with something that is bigger than us. So when it arrived on our shores in South Africa, the scientific community, how did it regard those nuances?
Yeah, I think in general, scientists are much better at navigating new knowledge, especially people who actually read the literature, the emerging literature, and we piece things together. And that's what we did. We got down to basically piecing the information together to try and see what we can learn about it and how to deal with it. And it's imprecise, Tsepiso, it's not accurate, but you are able to take the different pieces of the puzzle and start to form a picture which is incomplete. And with what you have, then you start to act and you have to make decisions. What was difficult in South Africa is that we are not used to making decisions with incomplete information. That is really difficult for us. But that's what was needed.
And as you say, these developments are then published and they're peer reviewed, and it has been moving very fast. I am curious of something, and I know the WHO Africa region pointed this out, that we have seen more maternal deaths in the past year on the continent than at any other time. And obviously it does also mean that there has been an increase in infant deaths as well. So just women in Africa, why have they been impacted so badly? Just mentioning this one area.
Yeah. No, it's a really important question, Tsepi. So I can tell you now that, we don't fully know the impact of COVID-19 yet. We are still going to find out. And when things settle down and we start looking closely at the data, we are going to see a lot more damage than we actually realize. So I can tell you, in terms of the disruption or the negative disruption that COVID caused, it affected the way we provide healthcare services. And it's amazing that a lot of people in South Africa live from hand to mouth. And I don't think that we, on a large scale, we ever acknowledged this than we did when we had the lockdown. We didn't realize how bad it is, which is why after the first lockdown, we couldn't go back. Because a lot of, especially women, they wake up every day, make ends meet, come back, feed the family and go. When you disrupt that, you break a whole system that supports a lot of people. And so in a way, I think that even our services, because now our healthcare services became risky areas where people can get infected, they couldn't go to clinics as they would normally do. They couldn't get the support that they are normally getting used to. There was this sort of negative consequence of, and someone called it the collateral damage, actually, of the way we had to deal with the emergency of COVID-19 in the healthcare system. And this is what I'm referring to when I say we are used to treating diseases and we're not good at treating people. If we were used to managing people, we would have actually anticipated a lot of these things that you may try to protect someone by sending them home, but you're causing another harm by doing that. If we were looking after people, we could be doing a better job in that regard.
Okay. So I want to then refocus the conversation on the data. We've had the latest research now from the scientific community in South Africa on immunity from the second variant of COVID-19. That people may possibly be safe from reinfection for a couple of months. But what perspective does it give us on COVID-19? Because there's an acknowledgement that mutations will also continue. And you're talking now about the management of the disease. What perspective are we learning from all of this research, especially what came out yesterday?
Yeah, I mean, from the perspective of the disease, really, the most important piece of information that the data provides is that the immune system that develops from the variant that was found in South Africa is also able to fight off infection from other variants. In my view, that's the only really most important piece of information. The stuff about reinfection is not really that important. I mean, people who developed immunity from the first wave were protected from infections from the virus, the type of the virus that was there in the first wave. So the fact that you are protected from the type of virus that infected you in the second wave, it's okay, it's news, but it's not really, doesn't advance us because it doesn't tell us so much about what will happen in the third wave, right? But what I think is significant is that this idea of cross immunity, where that the immunity that's generated is able to protect from other variants. That means that actually we might be able to come up with vaccines that can protect us from different variants. And these are so-called multivalent vaccines. We're really looking forward to that next generation.
Thank you so much for speaking to us, Professor Mosa Moshabela. He is the Dean and Head of Laboratory Medicine and Medical Science at the University of KwaZulu-Natal, just taking a look at the year that was since the first case was declared in South Africa. Tomorrow that milestone is.